Hi, everyone. Good morning or good afternoon, depending on where you are. Thank you so much for joining us today for the panel discussion we'll be having. We have a very exciting hour ahead, so let's just go ahead and get started. Marissa Katz, I'm a senior staff attorney at the Public Health Law Center, and co-moderating today's panel discussion with me is our research assistant, Katie Stapleton, who's also a second-year law student here at Mitchell-Hamlin. Katie will be formally introducing our panelists shortly, but I do want to go ahead and give a big warm welcome to Kimberly Fields of Guilford County, North Carolina, Jane Larson from Superior, Wisconsin, and Brisa Sanchez Cornejo from Washington State. We'll spend most of the hour talking with our panelists, but I will get us started with a brief overview of youth tobacco use, the highly addictive nature of nicotine products, as well as highlights of our Model K-12 policies enforcement section, which emphasizes non-punitive disciplinary measures against students who are struggling with nicotine addiction. Each of our panelists will then provide an overview of their communities where schools have implemented alternative to suspension programs, followed by a Q&A session for our panelists. Throughout the webinar, as Stephanie said, please feel free to type in any questions you have for our panelists, and Katie and I will do our best to field as many questions from you as possible towards the end of the hour. We always welcome and look forward to your thoughts and insights on this very important topic. But first, for those unfamiliar with us, the Public Health Law Center is a nonprofit organization housed at the Mitchell-Hamlin School of Law in St. Paul, Minnesota, and is located in the traditional homelands of the Dakota people in an area known as the Bdote region. The center has three main programs: commercial tobacco control, healthy eating and active living, and climate justice, all comprised of attorneys, policy analysts, and support staff working together to improve public health through the power of law. We offer free legal technical assistance to communities, public health advocates, and other partners throughout the United States. We also publish on important issues pertaining to each of our programs, as well as offer trainings and webinars. We do have some limits on our work. We don't provide direct client representation, give legal advice, or lobby elected officials. Health equity is centered in all of our work and is done with mindfulness of several factors that influence public health, including housing, education, the environment, and a variety of other social determinants, meaning we never want to offer policy solutions that would cause someone to lose their job or their housing and then subsequently impact their health. Policies, especially tobacco-free policies in school settings, should instead seek to balance the goal of protecting the public from the harms of commercial tobacco with knowledge that punitive measures against those who use these products are unlikely to help them in their struggle with nicotine addiction. Throughout this hour, we'll be referring to the effects of tobacco, but it's important to clarify we're speaking specifically about industrial scale commercial tobacco production and not traditional tobacco as it is still used religiously, medicinally, and ceremoniously in many different cultures. And as we dive into our topic today, it's important to acknowledge at the outset that we're living in very challenging times when it comes to vaping in schools. There had been significant progress with plummeting rates of combustible cigarette use. However, in the last several years, we've all seen this unprecedented epidemic in vaping among youth. And the CDC last November issued their annual National Youth Tobacco Survey. There's a little bit of good news in that fewer high school students were vaping in 2023, down from 14% in 2022 to 10%. However, e-cigarette use among middle schoolers remained at the same rate of 5%. But the numbers are still really high. About 1 in 10 middle and high school students said they recently used a tobacco product, which is 2.8 million kids across the country, with nearly 90% of students who vape said they use flavored products with fruit and candy flavors as their top preferences. So schools are truly on the front lines in battling this epidemic, which is unfair because they're cash-strapped as it is, but are nevertheless forced to contend with these really high numbers of students vaping and who are very addicted to these products. And as schools continue to deal with this crisis, it's important for school officials and administrators to have a full understanding of what these vape products are made of and how addictive they are. And you can see also clearly how these products are used by the industry to target youth with the use of bright colors, fruity flavors, and candy-like images. New products continue to flood the market shelves along with oral nicotine products like Zyn. And as you can see, some of these disposable vapes contain nicotine levels that are equivalent to multiple packs of cigarettes, which on average can be consumed in a matter of days, not weeks, so highly addictive. School officials should also remember that nicotine is not only addictive, but has negative health effects that are widespread and extend through all systems of the body. Smoking or vaping nicotine is linked to higher risk of stroke, heart attack, increased blood pressure, heart rate, as well as narrowing of the arteries. The evidence is there and it continues to mount. E-cigarettes are not safe products, despite what the industry says or how it markets these products to the public and to our youth. Speaking of marketing, the outsized role the tobacco industry has historically and continues to play in targeting youth, especially in and around schools, also cannot be ignored. The industry spends around $9.5 billion per year on marketing, much of it online and in retail environments. 90% of youth report exposure to cigarette ads and 80% to e-cigarette ads. So it's important to factor in these predatory industry tactics by the tobacco industry when we're dealing with this vaping epidemic. So when you factor in all of these, industry marketing, the health effects of nicotine addiction, and how very, very addictive these products are, schools' smoke-free policies should emphasize supportive rather than punitive measures like suspension or expulsion when addressing infractions of a smoke-free policy. The Public Health Law Center has resources that address this, including a model policy itself, a Q&A resource that explains the rationale behind specific components of our model policy, and a guide focusing on alternative measures to suspension, which provides sample language and evidence-based information on why non-punitive measures are more effective when addressing youth nicotine addiction. And just glancing at the enforcement section of our policy, we incorporate a set of escalating consequences for student infractions that are aimed at supporting youth in quitting these addictive products and resisting the peer pressure to continue to use. For instance, it's required under the policy that products be confiscated, that parents and guardians are notified, and that a student chemical health assessment takes place. And then there's additional options for tobacco education programs, cessation and counseling services, and finally, enrolling in educational community service. We emphasize addiction support and access to cessation. Each state, of course, provides free quitline services, and many local communities also provide cessation assistance specifically tailored for youth. It's important that a school policy refer to these resources that are available locally so that they can be widely disseminated school-wide or district-wide. There are also several organizations that provide free or paid programming as part of implementing alternatives to suspension in schools. This slide shows one example of a program sponsored by the American Lung Association, but there are many others out there as well that are evidence-based and free. The Truth Initiative, Alliance for a Healthier Generation, and the Stanford Reach Lab all provide a wealth of materials related to education, prevention, and cessation. And finally, I just want to briefly raise the issue of vape detectors. We know anecdotally that school districts across the country have been investing Juul settlement and other funds in vape detection devices and doing so at great expense. There are concerns surrounding the use of vape detectors. The first is their overall effectiveness, which remains uncertain. There are reported instances of false positives, students being able to easily evade detection, and so on. But importantly, their use creates a culture of surveillance, which then leads to punitive disciplinary action against students who are struggling with addiction. We have a blog post pictured on the slide about this very topic, intended for school districts considering how to spend either Juul funds or other funds. Our view, of course, and that of many other public health advocates, is that funds are better spent utilizing supportive disciplinary practices, education and prevention programming, and curricula, as well as the provision of evidence-based cessation programs. Here's an additional list of resources available on our website that may be helpful if you're looking to put together or update a comprehensive smoke-free policy for your district or school. With that, I will turn it over to Katie Stapleton, who will introduce our panelists joining us today. Katie.
Thanks, Marissa. Hi, everyone. Thanks for joining us today. As Marissa mentioned, our conversation brings together specialists from across the country working with an alternative to suspension practices. I'm going to share a little bit about each panelist before I turn it over to them individually to elaborate on their roles and programming. First, we welcome Jane Larson from Wisconsin. Jane is a licensed independent clinical social worker licensed to practice in Wisconsin and Minnesota. She worked in community-based mental health centers for 23 years prior to accepting a school social work position at the high school in the School District of Superior, Wisconsin, where for the past 6 years, she has been working with students in need of mental health and AODA support and services. Additionally, Jane has worked in the field of AODA prevention and treatment for 24 years and currently chairs the Douglas County Drug Prevention Coalition. Next, we have Brisa Sanchez Conejo from Washington State. Brisa is a dedicated certified prevention professional deeply committed to fostering diversity, equity, and inclusion in the Pacific Northwest through appropriate cultural adaptations. Currently serving as the Substance Abuse Prevention Intervention Program Supervisor within the Student Engagement and Support Department at the Washington Office of Superintendent of Public Instruction. Brisa's focus is on aligning the efforts with evidence-based practices and supporting student behavioral, social, emotional health, and academic success, wellness, and a commitment to fostering an inclusive and supportive environment. She brings over a decade of experience in public school districts and over 6 years committed to supporting substance misuse prevention programs for youth using evidence-based programs and best practices in schools and communities. And finally, we welcome Kimberly Fields from North Carolina. Kimberly is the substance abuse lead teacher for Guilford County Schools in Greensboro, North Carolina, where she has provided substance misuse prevention, intervention, and referral for 26 years. Prior to Guilford County Schools, Ms. Fields provided substance use treatment to adults, adolescents, and their families. In her current role, she serves schools K through 12, working with school administrators, school support staff, students, and families to provide programming and resources that minimize substance misuse as a barrier to student success. With that, I will turn it over first to Kimberly to give her presentation.
Hello, I appreciate you having me. I'm aware that I'm the only person on the panel from the South, so if I sound like a hick, I'm sorry. I just want to share with you that our district is 126 schools, K-12. I'm the only substance abuse person in the district. I work as part of the mental health team here. We have about 66,000 students that we serve in our district. We're the third largest district in North Carolina. You can advance the slide. So what you're seeing here is kind of the model that we use for addressing substance misuse in the school setting. I'm going to talk about prevention a little bit later, but I really want to just hit on the early intervention alternative to suspension programs because that's where that lies, and then referral. You can advance. So the first couple of programs I'm going to tell you about are the ones regarding tobacco and vaping. If you would go ahead and advance it. So with the middle school students and grades, what we have is an alternative to suspension program. You'll see there it refers to our rules. Our rules are set up kind of in tiers according to how severe and how dangerous they might be for students. And so the rule 1-10 and rule 1-11 are around vaping and tobacco use. And so when those rules are violated, when kids are caught vaping at school, those referrals come through me. We contract with a community partner to provide our tobacco education classes. The class is in the evening, and right now it's a live remote format, so it's virtual, but it's a live group. And they use the Our Healthy Futures curriculum from Stanford University's Reach Lab. And that focuses on the dangers of vaping and tobacco and making healthier decisions. And I coordinate those referrals. They come through me. And then what I do is I report back to the schools whether or not the students complete the program. Okay. At the high school level, what we have is an online program. In the last year, what we used was EverFi's Vaping Know the Truth curriculum. We went to an online curriculum because we used to use the old American Lung Association model when we had tobacco settlement money and lots of people that did this job. Unfortunately, we don't have that anymore, and so and things had really declined, as you were saying, with the tobacco use, and then vaping hit. And in order to serve the students, what we found was an online program really was the most effective way to do it. And so we were scrambling for a while to find one. Then we found EverFi's Vaping Know the Truth, which is put together by the Truth Initiative. And we used that for about a year and a half. So this last year, we implemented that using a point person at each high school. And then those students, a lot of times in ISS or on their own time, would go and complete that program. And the point person at the high school would monitor their progress in the program and then report back to the administrator. And then at a district level, I was able to monitor the data and look at how many kids were referred and do some evaluations. Next year, what we're going to do is we're going to change to using the My Healthy Futures, which is, again, Stanford University Reach Labs curriculum, because we found that EverFi really is a universal prevention program rather than an alternative to suspension program. So we'll be switching that up. So we have alternative to suspension programs for alcohol and other drugs as well. And these are they. You'll see that grades 5 through 8, we provide academic services and substance use intervention. And students attend while they're suspended. They're counted as in-school suspended instead of out-of-school suspended. And then our lifestyles program is for high school students. And the parents actually attend with the student. It's, again, a live format in the evening, and we contract those services out, and I manage those referrals as well. Okay. So prevention, I just wanted to include this very briefly. You can go ahead. At the school level, some of the information that I think is necessary for good prevention: consistent messaging, school-wide campaigns, peer-led prevention, and interventions for behavior, resources for help, and certainly including parents. And in the district, what we do is provide resources, programming, training as needed, and consultation to the schools. I work very closely with the social workers in each school. They're our point people for substance use or misuse prevention in the schools. Okay. And I also wanted to be sure to share this with you. This is our an example of some of the information that we send out. This is our vaping prevention toolkit. It has 4 components: curricula and lesson plans, school-wide prevention resources, resources for families, so schools can print that out and give it to parents, and then cessation programs for youth that want to quit. So that's a resource to hand out for you to youth during campaigns. And then we certainly do referral. Go ahead. And just by providing cessation resources, we also have school-based mental health and community-based mental health that we refer to as needed. That's my information. If you need me, I'm glad to answer any questions. Thanks.
Thanks, Kimberly. All right, now we will turn it over to Jane Larson.
Hello, everyone. I'm Jane Larson. I'm the school social worker at Superior High School. As mentioned before, I've been there about 6 years. When I arrived at the school 6 years ago, we did not have there weren't a lot of services or supports in place for students who were vaping or who were smoking. And it's, as the smoking numbers were falling, the vaping numbers were rising. And what I realized very quickly when we got there was that there was no way that we were going to be able to suspend our way out of this problem. And that's what was happening. If students were caught vaping, they were suspended. And that was, 1 to 3 days or more, depending on how many times that had been an issue for that particular student or other surrounding circumstances. So I had a long history of partnering with the American Lung Association. So contacted them and got trained in the in-depth program, which is the alternative to suspension program, in year 1, and began to implement that year 1. I'm the only person in the building who is doing that. So we are a district we had 6 elementaries, a middle school, and a high school. The elementary schools are using Catch My Breath in the elementary schools. And as we started rolling out some of the actual, what are we going to do about the kids who are getting caught, looking at what we could do, we included the middle school. I contacted the middle school, and when they had a social worker on board about 3 years ago, that person began getting trained as well. So in-depth became our go-to. And what we've realized, as we just heard, that the number of students who were getting caught and who were using this was greater than I could keep up with myself. So I try to do groups as much as possible with those students. And there's been some struggles with that. I think there's been a little bit of pushback. And if you've done this in your schools or you're thinking about it, be aware there might be some pushback from teachers who are saying, yes, but you're taking kids out of our classrooms. You're taking them out of class to come down and meet with you. And my response to that is, yes, I may be taking them out of your class, 4 different times over a period of a couple of weeks to meet with them. However, if they're suspended, they're gone for multiple days, all day long, and they're at home often unsupervised and able to continue to vape or whatever with no intervention. So, and now I have the staff supporting me, and our admins, most of the staff supports that, and the admin is on board with that too. So in-depth has been a huge thing. In the last year, in-depth through the American Lung Association has put out a online version that we are starting to use because I can't keep up with the number of referrals. I don't always get all the referrals. I think sometimes I get lost in the mix of things that happen. So I don't always get notified, but I have 94 referrals for kids who were vaping, and those were kids' first time getting caught. And there's been other kids who are asking to come back because they've been caught a second or third time, and they're asking to come back for some additional support. So we have that, and we are beginning to use the dashboard and the online system, which is good. We're able to monitor progress. We can see what they're doing. I can meet with them. I do meet with them. Each student, I meet with them at least once to make a connection, a human connection, to offer support, to talk to them about where they are and with wanting to do something different. And just to remind them, I can't tell them what to do or not to do, but if they continue to do what they're doing at school and get caught, there's going to continue to be consequences. So if they're interested in doing something different, come and talk to me, because we also have resources that we give them. So that's been pretty effective. I've had a number of students come back and say, yes, they do want some help. They're figuring out that they are not able to stop on their own. So good connections made there. We're also using the NOT program. It's a 10-week cessation program. It took a little while, again, working with administration they agreed that that was necessary. They struggled a lot with having kids miss classes again to come down for that group. But I ran 3 NOT groups last year, 10-week groups, and I had originally had 12 kids going. We finished with 11. 4 of them successfully quit and stayed quit. 1 quit, relapsed, and came back for help. So it's important that we offer them. Every one of those students made some sort of change in their relationship with nicotine products, either reducing greatly or quitting. And I've also had kids come back and ask to go through the group again because they relapsed and they're looking for that support. So that's also a really positive thing for us. We're working on we have a group of students in our school, at our high school, called the Pledge Makers, students who've pledged to remain alcohol and drug free. And in this past year, that group has kind of been on fire around the vaping issue. They're banding together. They're asking for support from myself and other people in the building to help them put their thoughts together on paper, to talk about what they see happening in the school, their frustrations with it, things that they think could be implemented that would be more helpful. They've also decided and have already done this. We helped them come together and really refine their thoughts, get it on paper, and they went and met with the mayor to talk about what they want different. They don't want more vape shops in town, and they want better training for the people who work in the vape shop, so they're not selling to kids who are underage, that sort of thing. So we've got a lot of good things going right now at the school. The other thing we also work with, we're making referrals to outside resources. We've got quit lines. When kids get caught, their parents are notified immediately. Their devices are confiscated. They don't get them back. We've had parents ask if they could come and pick them up, and we say no. They're just gone. So but we're trying to work with parents as well. If we're teaching, I feel like if we're trying to help support kids in making some changes with their vaping, talking to the parents and keeping them abreast of what we're doing in terms of supports to help their children is also helpful. So I do that as well. I send out emails to the parents, or I send through the mail, I'll send information on some ways that they could help support their young people as well. Another program that I'm working with is SBIRT, Screening, Brief Intervention, and Referral to Treatment. So working with those students one-on-one, looking at what they might consider a good goal to work toward, and then meeting brief interventions with them to help support that, and then referrals to treatment, whatever that looks like for each of them. Those has also been a successful intervention that we're using at the high school and at the middle school as well. We are doing more and more with trying to, even with second and third offenses, trying to keep kids in school. We also have a tiered response related to violations for our code of conduct. And so anything from classroom interventions all the way up to a level 5, which is intensive intervention, up to and including removal from school. So with our violation of tobacco policies right now, we're looking at a minimum response would be an intensive intervention with administrative discipline. And that could look like, the administrative discipline can be, you have to go do this. You're going to have an in-school detention, and while you're in detention, you're going to go meet with a social worker. So we're working really hard to not have kids out of the building. Our principal's wonderful. We get a support from the district level with this, and so that's kind of where we are. And in terms of that tier 1 prevention, we're doing a lot of that through advisory, and we have students now helping support students. So I think that's a little bit about us and what we're doing, and I am happy to answer other questions that people may have later. Thank you.
Thanks, Jane. All right, now I will turn to Brisa to give an overview about herself and how her programs work.
Thank you so much. That was such wonderful information. And I'm always so impressed and awed by all the work that is being done at multiple school districts across the nation. I did want to share that in my work, I support school districts across the state, as well as partner with other programs at the Office of Superintendent of Public Instruction, which is our state education agency, to help support the vision of all students prepared for post-secondary pathways, careers, and civic engagement. And this is done through transforming systems, closing opportunity gaps, and empowering educators, families, and communities. The values that we hold at OSP are ensuring equity, collaboration, and service, achieving excellence through continuous improvement, and a focus on the whole child. This is our equity statement, and I do want to highlight just one thing here that I think is very essential to this work that is happening, which is we actively work towards dismantling systemic barriers and replacing them with policies and practices that ensure all students have access to the instruction and the support that they need. I do want to highlight that at Washington, in Washington State, it is a local control state. So for us, this means that schools follow federal and state law, but then after that, they are very much leading the work that is happening there in their school districts. There are 295 school districts. There are 2,393 public schools. So there is a lot of work going on, and it looks a little bit different everywhere. In our state, there has been some disciplinary policy changes, and the intended impact is to slow the decision-making around discipline and that process, to specifically limit the use of exclusionary discipline in schools, ensure that educators are considering the unique circumstances, the context, and school safety when they are making these choices, and minimize the impact of exclusionary discipline on students who have been historically impacted most by these practices, and of course, reduce disparities. The purpose of discipline in Washington State is supposed to be to respond to the needs and strengths of students, support students in meeting behavioral expectations, and keep students in the classroom as much as possible so that they are benefiting from instruction. In Washington State, we know that traditional discipline in the past has been very much exemplified by this image right here and this quote: if your only tool is a hammer, this tempting to treat everything as if it were a nail. So treat every student exactly the same across the board. But in the past, this has been punitive. So we have been encouraging and moving towards a multi-tier systems of support model to help support youth in their growth and their educational journey. And of course, because all school districts are unique and have different needs, different gaps and resources, the services that are implemented at each school district look just a little bit different. And we encourage them to adapt these services to fit their own needs and communities. This is a very, very busy and involved slide. But I do want to share that in Washington State, there is a big move towards tiered frames around supports, and data shows that strong correlation between substance use, mental, and social and behavioral needs. So a best practice is to establish a multi-tier system of support framework to coordinate resources and services that are meaningful and appropriate to the behavior and underlying support needed. And you will be getting these slides, so don't worry about reading through all of these. This is very, very busy. But I did want to share a slide in which exemplifies really what this is intended to do. So as we know, Tier 1 supports will support or offer services universally across all of your student population. And then as the needs grow greater, the tiers start stacking upon each other. And this is there for a purpose so that we can continue to support the growth, healing, and services that are needed by individual students. So Tier 2 will stack up on Tier 1, Tier 3 will stack upon Tier 2 and Tier 1. And this allows us to then support at a more targeted and more intense way the kids as they have needs. And lastly, these are some of the substance use intervention resources that are encouraged to be used in Washington State, but of course, they are not gate-kept. If you would like to use them in your location, in your school district, in your state, feel free to check them out. These are really great resources, and they are intended for public use. At OSPI, we really encourage our school districts to find and meet their own individual and unique needs. We know there is regional overlap between needs, so we also encourage them to work with each other and work with their communities and community service providers to help support kids as they are needing supports and to help them get back into the educational system to get instructional time and in the future graduate and be really thriving young adults who can take on life's challenges. This is my presentation, and I'm happy to answer any questions. Our information is all public, so feel free to reach out if you have additional questions after this presentation. Thank you.
Thank you, Brisa. All right, I will now kind of move over to the question and answer portion of our panel here. First, I wanted to ask, Jane, you talked a little bit about a tiered enforcement or graduated enforcement within your school. How quickly do you have to commence that intervention work, and what challenges does that bring?
So when I get the referral, the administrator, when a student is caught, an administrator is brought into that as part of that intervention. So they may have some other history or know some other infractions or other things. So our principal is the person who decides what level we're going to be at with this particular student. If it's a level 3 is a minimum response to a student who breaks the tobacco policy. So that usually is in school suspension with restorative practices. It can be a 1-day suspension, out of school, whatever. Revocation of privileges. It kind of depends on circumstances. But once that decision is made, I'm contacted. They either call me, they send me an email. I get something that tells me that the student is in need of services. So I'm trying to begin within a week if possible, to get them fit into my schedule. This year, that's been a little more difficult with 94 referrals and 1 social worker and all the other things that go on. That's been harder. So, but that's the plan. And then my goal is always like, when I can meet with the kids, I think that's more effective. I personally believe that person-to-person connection is more effective than using online services. It's about a personal bias. So I try to do that, but when I can't, they go online, and I meet with them always at the front end and get started with them, and then try to check back as they're finishing. I meet with them, ask them what they learned, have a few minutes, kind of what was that like for you, and then offer more resources and other services that I can offer in-house in the school.
Great, thank you. And when you are triaging and when you get all these referrals and you're kind of deciding how do you address, the number of referrals based on the resource constraints, how do you triage that? How do you go through and determine who has priority to get started within the program?
So this is the first year that's been an option for us with the online thing. So with the online program. So at the beginning of the year, I just start creating a list. Like as the referrals are coming in, I have a spreadsheet. And as I'm able to start with kids, I start with them. If I have kids who I know would work well together, I'll do small groups of kids in depth, take them through as a group, which helps. That doesn't always work because of, we have kids are here on a half day or they have other things that prevent that from happening. But once I'm getting to the place where I'm backlogged, and this year when I was backlogged and I'm just not keeping up, and then they're not, I think for me, I also believe that the sooner the intervention can happen to whatever it was that they did. So they got caught vaping in the bathroom. I think the sooner that I can intervene and meet with them, the better it is. If this happened here and I'm not getting to them for 3 weeks out or 4 weeks out, that's not as effective. So I think that's this year how it worked, that as soon as that online program became available, we were able to get set up and get on. As I was backlogged, then I started putting some of those kids in, and then trying to stay in touch, but just shorter periods of time with them as check-ins, person to person. And there are some kids, I think, just knowing who they are and their level of functioning also is a determining factor. If they're not doing well, they're not on their computers, they don't use their computers, asking them to do an online program is not going to be successful. So some of those things come into play.
Definitely important to meet students where they are with their needs. Kimberly, you've been in your role for several years, so you're in a good position after years of overseeing your district's alternative program. With that experience, how does an alternative program square against traditional enforcement measures like suspension or expulsion? Is there a noticeable outcome for students that participate in alternative programming that differs from those who have been suspended for smoking or vaping at school?
So I don't have hard data to back this up, but I'll tell you what I do believe about this is that if you don't provide an intervention, that we're just enabling the behavior. It's that old enabling that happens with addiction and family systems. It can also happen in a school setting with behaviors, and it can certainly happen with nicotine addiction, in that we just give a punitive response, but we're not providing any help. And so I think providing the intervention offers a break in that cycle and gives students a chance. The other thing that we all know, and I know I'm preaching to the choir in this webinar, right? But the thing that we all know is that the more times somebody tries to stop using tobacco or nicotine, the more likely they are to be successful in the long run. And so anytime we can intervene and help them get off that roller coaster of addiction, the better, right? So let their brains heal just a little if they can.
And with that, your school district imposes in-school suspension for policy infractions. Even though you're still suspending students, Can you explain a little bit about how an in-school rather than an out-of-school suspension can benefit a student who's struggling with nicotine addiction?
I think when you really think about building protective factors and the relationships that are included in that, academics that are included in that, providing, again, the intervention, rather than sending kids home, of course, if they're at school, even if they're in school suspension, hopefully they're in a classroom where they're going to get some support for their academic work, some support for their changing their behaviors, some support for looking at their nicotine addiction. So I think what that does is it continues to build protective factors while providing also consequences, because there is a large faction out there that still believes that if you just that we don't want to let them get away with it, right? And that they need to be accountable for their behavior. Certainly people do, but the folks that move into restorative practices and those kinds of things, that's such a long trip for a lot of people. And so in a way, providing in-school suspension also kind of satisfies that. So there's accountability, right? But at the same time, we're not just throwing them out the door. That's my thinking about it.
And Jane, were you going to add something to that?
Yeah, I think when they're in school, there's also that ability to be checking in when they're in an in-school suspension. And there are, to your comment, Kimberly, there are consequences when they're in school suspension. They're not eating lunch with their friends, but they're in the building. That gives me and others an opportunity. This is going to sound bad, I guess, but when the kids are have in-school suspension, that gives me an opportunity to meet with them. They're not in their regular classroom. I have an opportunity to go meet with them and build that relationship, just checking in. How's your day going? Do you need a bottle of water? How is it going? What can I get for you? Those sorts of things, which builds that relationship. And the other piece I wanted to say was, we don't expect adults to just quit. We don't expect them to just on their own, it's like why we need to build those supports and build those relationships so they're willing to accept the supports. And once is not enough. For many adults, once is not enough. Most adults don't quit the first time they try. So to expect our youth to do that's just not reasonable at all. So letting them come back. I mentioned when I spoke earlier, like I've had kids who come back and say, can I do the in-depth program again? Or they've been through the NOTS, the cessation program, and they've relapsed, and can I go through it again? And we have people who said, well, they did it once. And I'm like, do you know anybody that's quit? Have they quit the first time? Do they not need to go back and do some things again? And our kids our students are so much more limited into what's available for them that they can easily have access to. There's medications and things that support adults that aren't necessarily available to our youth yet. Doctors who aren't prescribing. So it's a whole host of things. So the more they're asking for, if they're asking for it, I say, let them have it. They're not going to succeed academically in the ways that they could when they're battling an addiction. So if they're going to be distracted and they're out in the bathrooms and vaping and whatever, let them come to me for an hour a week and work with a cessation program. It's 2 times or 3 times, whatever. So I'm really passionate about that. And my staff knows it. My administrators go, yep, if they want to go, just let them go back. But it's true. And it makes a difference. It makes a huge difference.
All right, Brisa, I'm going to come to you quickly here. Washington is unique because of the statewide law recently passed to prohibit zero tolerance policies, implement restorative practices, reduce exclusionary discipline for behavioral violations. And I know the state supports the school districts in making the changes. What are some of the noticeable outcomes for students that you have seen since the state law was passed or within the different school districts?
Well, there's definitely been a reduction in the percentages of students excluded, which, as we know, that is always a good thing. There's been an increase in school districts feeling more empowered and more this is anecdotally, and feeling more able to really offer services that are outside of the traditional model so that they can help support students come back into the classroom in a way that works better for them. Also, the state has adopted, or multiple school districts across the state have adopted additional supports, and there's been an influx of other programs that are coming to support school districts. A program that I can think of that I was a part of before my role with the state was the Community Prevention Wellness Initiative, which is a community-based organization model. So it's a program that does community work, community programs, and they do implement evidence-based practices and programs. And as part of that work, they also support school districts with evidence-based programs. One that I can think of that has been very, very successful, and almost every single family I've ever heard of that has participated in this program has gotten some really great skill building opportunities and results. On the other side is the strengthening families for families with youth ages 10 to 14. This is a wonderful program, and like Jane was mentioning, there's families that want to come back and want to come in with the new child that just turned 10, or they did the program again, but they want to do it one more time to really reinforce communication, reinforce problem solving within the family, reinforce setting limits within the family, and making sure to vocalize like their expectations of their children. It's a really wonderful program, and the state does encourage school districts to work with these programs to help support and accentuate some of the things that they're able to offer, specifically for school districts that are very rural and that are very far away from resources and services. Some families have to drive a whole hour to get into a treatment or one-on-ones with a therapist or treatment provider. And it's just incredibly difficult. So having access to these additional supports definitely helps school districts do more for the families and do more in a way that is more cost effective for them and energy efficient for them as well, because they're working in collaboration versus just in silos on their own, and sometimes really far away from services.
And as a follow-up question, and we're just curious to know, is there funding attached to the Washington state law? So if districts are required to implement these alternatives to suspension, is there state funding to implement these programs?
Not always. There are some grants available for school districts to help support some of the work and fund some professionals to support that work, but not all the time and not for all school districts, unfortunately.
And since the introduction of e-cigarettes or vapes, annual studies have shown kids are initiating vaping increasingly at younger ages, which creates a need for programming starting earlier, such as kindergarten, elementary school level. How do the school districts that utilize the K through 12 approach in your state compare to those that only have a middle or high school program? And this one's for Brisa as well, sorry.
We can definitely see some of the data shifting. So we have a data set in Washington state called the Healthy Youth Survey, and this is a statewide data collection effort that a lot of school districts participate in, and we can really see the data shifting. That data collection effort starts in 6th grade. So earlier definitely allows us to see some of the data shifts. There's a particular section called On Hope. So measuring whether the kids feel that they can take on challenges, whether they feel supported, whether they feel empowered. And that allows us to see some of that shift coming in when interventions are starting earlier. But again, not all school districts have the capacity or the access to offer those interventions. So we definitely see some positive movement in states that, in school districts that have these resources attached to their school district, but not all of them, unfortunately. And it really does come down to capacity and having the staff to be able to do these implementations and having the connections to other community organizations and other supports that can bring in these interventions to the little ones. There's a really fun program that if you haven't heard of it, I recommend looking it up. It's called Samantha Skunk. And this program does plays for little ones at the elementary age. I know that the earliest I've seen it done is kinder. So kinder through first grade was the earliest intervention I saw. It is so cute, and they focus on different topics. One I can think of the top of my head is like the Save Your O's, so for oxygen, and that's a kind of a geared towards vaping and geared towards making sure that you understand that, you know, your oxygen is very important. And it's super cute intervention. It's innovative, but it's really cute. It works. Kids are talking about it for weeks on end. There's a bright pink skunk involved, so you can imagine it leaves an impression in the little ones' minds. So I do encourage school districts to look into it if they haven't, and we do see some really positive movement in school districts and just staff's ability and administrators' confidence in they're doing something for their school. So it also increases that, which we know is very important, because it is awful to see these things happening in our school districts and then have our wonderful staff who are passionate about this work, passionate about education, and seeing our kids grow up happy and healthy, feel like they are not doing anything to address these things. So interventions like these help empower administrators, empower educators to feel like they're making a difference for their little ones' futures.
Thank you. Kimberly, in your school district, parent involvement is part of a policy enforcement. How does this work, and what do you see as the benefits or challenges with getting parents and guardians involved?
Well, the program where parents attend is our program for high schoolers that get caught with alcohol or other drugs. And so parents attend that program. The other programs, the parent involvement includes just being contacted and helping to set up, to schedule the classes on the middle school level with the tobacco program. It's, you know, we have a spectrum of reactions from parents, as you could imagine, right? Parents that say, I didn't do this, I shouldn't have to go to these classes, to parents that are calling and saying, can I put my kid in these classes? They didn't break a rule, but I want them to learn something from it. And we offer that as well. But what we see is that, again, if you're looking at, you're looking at the whole picture of the system there, if you're just taking that one kid and giving them information, they're still going back into that system. There may be parents that think that vaping is okay for kids, and we run into that sometimes, or parents that vape themselves or use themselves. The more you can intervene in that family system, the more effective your intervention is going to be, even if it's just early intervention. And so that's kind of what we face, including the parents. But I think it's essential whenever possible to include them.
Agreed. So that kind of goes, to buy-in. Brisa or Jane, did either of you have any input on kind of the challenges you see or the benefits you see with buy-in, either from the school level, administrators, or parents, students themselves?
I think, as Kimberly said, when a student at any level, middle school, high school, even upper elementary, gets caught with a vape, parents are automatically notified. And they, at the middle school and high school level, they're told, that on a first offense, that in lieu of a suspension, your child is going to be asked to participate in the in-depth program, which, it's not, parents are told this is not a cessation program. It is a program that helps give the students some information, helps them look at what their patterns and habits are around substance, using that particular vape or whatever it is. And then let's see what is your motivation to do something different? Could we help you tip the scales in favor of making some changes that would reduce the risk of future consequences related to use? So parents mostly, I can only think of one time that a parent said, no, send my kid home. I don't want him talking to anybody. So most parents are on board with it. I've had parents say, well, last time I got to do this class, can't they do that again this time? And I'm like, yeah, they can come and see me as often as they want to. What the principal will decide in terms of some other consequence is up to that principal. But we have had a number of reductions. The other thing I'd like to say that also, like Kimberly, is I do another program. It's called Teen Intervene. It's a program that Dr. Ken Winters out of the University of Minnesota developed. Hazelden bought it. And so if you're interested in looking at it, Hazelden has it available. But it's about, any kind of substance use with kids who are dabbling, who don't meet criteria for a substance use disorder. But it involves, motivational interviewing. There's screeners, and it involves at least one session with parents where so some of those times, those parents, I'm talking to them on the phone. I try to get them in-house if I can. But what are your rules? What are your expectations? What's okay in your family or not okay in your family? Here's some things to think about in supporting your child, your student. And for the most part, if transportation is an issue for a lot of our families, so I've said, do you have a computer? Can we set this up on a Google Meet? Can I talk to you on the phone? Can we go through this? So I kind of do whatever I need to do to get those parents involved, to have those conversations and find ways to give them the information that about the things that I'm talking about with their student. And here are some ways that you could support them if you're interested in doing so. And then give them my information so they can contact me if they have questions or are looking for more help later. It's important to make that connection.
And Jane beautifully explained how important community and family engagement is at the school district level. And that is one thing that we highly encourage, like having multiple points of connections with your community and with your family, so that if you are ever in a position where you are asking them to take part in an intervention, they are more likely to respond positively, because that's not the first time they've interacted with you as an administrator. In addition to that, some of the technical aspects were really encouraging engagement and empowerment in our families and youth, who making sure that the service is in their language, in their level of comprehension, so that they are able to participate in a way that is useful and really going to help them. And if they can take the program in their own language, we encourage that. We encourage them to offer resources and services and programs in the language of the population that they are serving, be that Spanish or any other language. And we do offer technical assistance to help in any adjustment, or help research, or help brainstorm programs and interventions that are language, I'm losing my word here, that are appropriate to the language of the population, so that they are, getting the most out of that intervention.
In just the 2 minutes we have left, I want to be able to field a question from one of our participants. We have a few, and they're fantastic. One of them, and this is for anyone, if you have any tips for helping to explain to schools and their school resource officers why they shouldn't be writing citations for students who are caught vaping. In this individual's district, the resource officer issues a $300 ticket to students as a petty misdemeanor on the first violation of a school's tobacco policy. So any advice, tips you have? Their argument is that this is the only way we can get students to pay attention to the consequences of vaping. So what advice would you have for school districts like this, where it's really an uphill battle for advocates like us?
I can jump in at the beginning of this. We really don't want kids to have a record. And so, the more we can wait on that, or postpone that, or not approach things that way, I think is so important, because we don't want to be a pipeline, right? Where kids are just getting punitive measures. And there was something else I was going to say, and I've completely forgotten it. So I'm going to let somebody else jump in.
I think going back, going with Kimberly said, we don't, yes, they're breaking, there's a code of conduct, we have rules, they're breaking the rule, but penalizing them at that point is not, I think about the reasons why kids vape and the reasons, why they're using. for a lot of the students I talk with, they're dealing with stress, they're dealing with all sorts of things, and vaping helps them. I mean, adding a $300 fine to a ninth grader who doesn't work, and we talk about equity, what does that do to a family? And they always say, well, that's the student's responsibility. Well, a lot of parents are going to try to get that taken care of. Students who are at ninth grade, may or may not be able to work. It just adds a whole nother layer of stress. It is not healthy. If the goal is to get them to a place where they can stop, adding fines and finding them right off the bat is not the way to help do that. They need information and they need support, and that is not building a healthy, good relationship with that person either. So I don't know. We had conversations about that too.
Also, I think it's not equitable. Your families that are living in poverty are going to really suffer from some of that. So it's just not equitable. The other thing is, I think kids are starting to get that there are some consequences to vaping. I think they're starting to learn. They're coming, that when I meet with them or have the opportunity to, which is rare, but what I'm finding is they know some things about how vaping affects the body now. The message is getting out. The numbers are starting to drop, not nearly what we want them to be, but it's almost like it started to take that turn. And so I think they do know some of the consequences.
Well, with that, we're at time, so we will wrap up. Stephanie said in the chat for everyone to please take a survey as you log off, so that we can make our webinars better based on your feedback. Thank you so much to our panelists for joining us today for this wonderful and enlightening discussion and sharing your expertise with us. Thank you to my co-moderator, Katie, and have a great rest of your day, everybody. Thank you so much.